by the Secretary General of the United Nations, Ban Ki-moon. Mr. Ban needs no introduction, so I will simply take this opportunity to express my personal thanks for his extraordinary leadership for sexual and gender minorities, and particularly for his vocal advocacy for putting human rights at the center of the HIV response. Secretary Ban.
Thank you, Professor Beyer, for your strong commitment to work with the United Nations for many people suffering from HIV/AIDS. And I'm also honored to be here with His Excellency Cyril Ramaphosa, Deputy President of South Africa. And I really thank you for your leadership and commitment. Of course, you know, I'm sitting together with many high-powered and influential dignitaries, including Executive Director of UNAIDS, Michel Shedibe, and UN Messenger of Peace, a very famous person, South African, Charlize Theron. It's a great pleasure to see you. And also Mr. Mabasa, Ms. Shinsana. Thank you all your commitment again. Ladies and gentlemen, distinguished guests, particularly I appreciate many media who are here and covering, as well as sending all these messages across the world. And I count on your continuing engagement and role. Ladies and gentlemen, 16 years ago, Nelson Mandela addressed the International AIDS Conference here in Durban. He called it, I quote, a gathering of human beings concerned about turning around one of the greatest threats humankind has faced, unquote. Madiba brought his towering courage to this cause. He supported all people affected HIV. He called for access to treatment, equity, and human rights. That was a turning point that led to remarkable global progress. For every one person who received life-saving treatment back then, there are now 17 who have it today. That means we have increased 17 times at least the number of people who are being treated. But still, 20 million people do not get access, and 13 million people still do not get the care they deserve. Today, some countries have no babies born with HIV. That's very encouraging. But many children living with HIV still lack treatment. I call for Durban 2016 to mark the commitment to a new era when we finish what we started, the era of a fast-track response. To end this epidemic, we must close the gaps that keep people from accessing services and living with dignity. We have to expand resources, science, and services. And we have to protect and promote the rights of people living with HIV, gay men and other men who have sex with men, transgender people, sex workers, and people who inject drugs, and prisoners. When we do this, we can end stigma and discrimination, prevent the spread of HIV, and save lives. Ladies and gentlemen, members of the press, this will be my last International AIDS Conference as the Secretary General of the United Nations. I had the honor to succeed Kofi Annan, as you know very well, who was genuinely dedicated to this cause. He remains a great fighter against AIDS to this day. Over the past 10 years, some of my most moving meetings as a Secretary General have been with the people who are living with HIV. Just a few months ago, I visited a pediatric HIV support unit in Burkina Faso. The country has been hit hard by AIDS. Thousands of teens are living with HIV. Tens of thousands have lost a parent to the disease. I was there to show my strong solidarity to the people, a call for equity, access, and justice for people living with HIV everywhere. As I walked through the facility, I saw a young woman who looked as poised as any adult. Her name was Deborah. When I asked about her struggle, Deborah made the passionate appeal for assistance and goodwill from international community. Here in Durban, we can answer that appeal for the sake of this bright young woman, for all people living with HIV, and for future generations. I count on your engagement and strong commitment. I thank you.
Thank you, Secretary General. Our next speaker is the Deputy President of South Africa, the Honorable Cyril Ramaphosa. As many of you know, the South African government's response to HIV has improved by leaps and bounds under this administration, and Mr. Ramaphosa has played a prominent and important role in those efforts, most recently launching a national HIV prevention campaign for girls and young women. I'm grateful he could join us today.
Thank you very much, Program Director. And ladies and gentlemen, it's a real pleasure and a privilege to be amongst you all. On behalf of the South African government, I would really like to thank the International AIDS Society and its partners for bringing this International AIDS Conference 2016 to Durban here in South Africa, in the province of KwaZulu-Natal. This, as most of us will know, is the second time that South Africa is hosting this global conference, a gathering of some 18,000 people, which really brings together a number of key players in this struggle against this epidemic: professionals, health workers, scientists, activists, policymakers, and indeed also people living with HIV. And all of us are involved in the common cause of ridding this world of this epidemic. And this conference opens on the birthday of our former president and our collective global champion of the struggle against HIV and AIDS, Nelson Mandela. His leadership and quest for human rights and equity for all people is well known and is recognized beyond the borders of South Africa. And in many ways, as we celebrate his birthday today, which the UN has recognized as the Nelson Mandela Day, we are acutely aware of the profound responsibility that we have. Nelson Mandela's memory and the holding of this conference gives us all an opportunity to understand the gravity of the epidemic, while enabling us to look at a number of innovative solutions to ensure that we achieve an AIDS-free society in our lifetime. The theme of this conference is quite apt: access, equity, rights now. This resonates strongly with the provisions of our own South African Constitution that makes access to health services a basic human right. This conference will challenge us, particularly as governments, to continue our work with our partners to build quality health systems and to provide accessible services and support to our people. As individuals, we have the opportunity and equally the responsibility to make the right choices for our health and wellness. Since South Africa last hosted this conference the world has turned the tide of HIV and AIDS. In our own country, it has turned quite dramatically. Great progress has been made across the globe and indeed in South Africa as well. Of the 17 million people currently on treatment worldwide, nearly 10.3 million are in this region. The latest information from UNAIDS is that the number of people on treatment in Eastern and Southern Africa has more than doubled since 2010. Later, we will talk about the strides that we have made ourselves as a country in this regard, particularly in relation to treatment and how we've been able to save lives. AIDS-related deaths in the region have decreased by more than a third over the same period. An important aspect of all this being mother-to-child transmission of HIV has dramatically been reduced. And despite these successes, we must say that the fight against HIV, AIDS, and TB is not over. Too many people living with HIV still do not know their status. Too many do not have access to treatment. The rate of infection remains stubbornly high, particularly amongst the most vulnerable populations in the world. We know, for example, that adolescent girls and young women between the ages of 15 and 24 accounted for around 20% of new infections globally last year. This means that as we work harder to provide testing and counseling services to the general population, we need to ensure that adolescent girls as well as young women, young adults more broadly, men and women, receive information and advice and are able to access services such as condoms and, where necessary, pre-exposure prophylaxis. We need also to design and implement programs that address the needs of key populations that are at risk, the risk of infection, including sex workers and people who inject drugs and men who have sex with men. We are optimistic that the deliberations here in Durban will yield commitments from the international community to invest in research as well as in development that could lead to new opportunities and options for a vaccine and a functional cure. We must work harder to achieve this. I cannot end my brief remarks without thanking the Secretary General for taking time out of his very busy schedule and coming out to South Africa, to Durban, to join us today. This illustrates his continuing support for the global fight against HIV. And I must say that under his leadership, the UN high-level meetings have galvanized all member states to do much more to end AIDS. I wish, on behalf of all South Africans, to thank you, Secretary General, for your contribution to a healthy and peaceful world. In conclusion, I wish all the delegates who are already here that in their deliberations they will be able to come up with suggestions, proposals to find solutions. And I do hope that your attendance here and your coming here has been smooth. I've been glad to hear that people have been able to register quite easily, and their passage through all the stations where they needed to has been good. So we thank our security services, our host committee, for the wonderful work that they have done. And then again, I thank UNAIDS for making all this possible. Thank you very much.
Thank you, Mr. Ramaphosa. I'd like now to call upon Michel Sidibe, Executive Director of UNAIDS, which has released important new data over the past week, highlighting gaps in HIV prevention and a decline in donor government funding for HIV. Michel has been an extraordinary global ambassador for the HIV movement. We're all deeply in his debt, and I'm pleased he's here with us today. Michel.
Thank you. Thank you, my dear friend. Your Excellency, let me start by just saying that I was privileged to have a boss like Secretary General Ban Ki-moon. He's truly a man of social justice, of fight for equity. Without him, we would have not have two words, central words in our sustainable development agenda. The first word is dignity, restoring dignity of people. The second word is left no one behind. And I think that's what brings us today together, because I remember 16 years back, we were all struggling, not knowing what to do. The hospital were full of people dying. And Kosi Johnson called on us to make sure that treatment could be made available to people and to not just have two classes of population, one in the north with medicine and one in the south without anything except just time to wait to die. And today I am happy that we are back in Durban, and we have been able to respond partially to his call. We have been able, in fact, to move from less than 1 million people on treatment those days to 17 million people on treatment today. We have been able to reduce only in South Africa by more than 84% the numbers of babies born with HIV in less than 5 years, which is just amazing. We have been able to put 3.4 million people on treatment in your country, which is the biggest program of treatment in the world. But let me say clearly to all of you that I am scared. I'm scared because we are back again in South Africa, in Durban, in difficult times. The world is facing many other competing priorities. Terrorism, migration, so many issues that I'm scared because I'm seeing for the first time the decline on financing from donors countries. 13 out of 14, Mr. Secretary General, reduced their contribution to the response. And I'm scared because at the same moment, I'm seeing domestic resources being increased. Countries like South Africa putting $1.6 billion from their own budget. And if we continue with this trend, the only things I want to say is we will not be able to end AIDS by 2030. The risk is that we'll have a rebound in this epidemic. And I cannot be dishonest with you. I need to say we will have a resistance. We will be losing our investment. We will have to pay more later. We saw that with malaria. We reached a level where we were able to think that we control malaria. Today, we have to put a lot of money again because we stopped. And I want to say also that I'm scared because I'm seeing the need to strengthen our health system. If we don't have a strong health system with a subsystem, with millions of community health workers, we'll not be able to reach those people where they are. We'll not be able to give treatment to those millions of people who are waiting. And I am calling here for 1 million community health workers to be trained before 2020. And in South Africa, maybe 200,000 of them should be trained to make sure that we have an alternative service delivery system. And I'm scared because I'm not seeing decline on new infections amongst adults. And that is scaring me because we have 1.9 million new infections every year since 5 years ago. I'm not seeing a decline on new infections amongst adults. I'm scared because I'm seeing more young girls, like you said, young women being infected. And those are the issues this conference needs to address. We need to be able to call on donors to make sure that they could understand that it's not time to stop. If we stop now, we will certainly regret because we will see a resurgence in this epidemic, and that's not what we want. I'm living here, of course, with 10 commitments which are coming from high-level meeting, which will help us to continue to push action, to make sure that we reach 30 million people with treatment by 2020. We need to do that one, to ensure that 1.6 million children have access to treatment by 2018 because they are forgotten phase of our epidemic also, and to ensure access to combination HIV prevention for all. I think that calls which are in this 10 commitment will certainly create a new space for us from now to 2020 to 2030. I want to stop here, but again, let us not forget, I don't want to lie to anyone. I don't see Zambia, I don't see Malawi, I don't see even South Africa alone being able to put people on treatment and to reach the level we want to reach. If we don't continue with global solidarity, if we don't continue with shared responsibility, we will see, unfortunately, millions of people developing resistance, millions of people losing their capacity to accompany this great success story. Thank you.
Merci beaucoup, Michel. It is an honor now to introduce Nkosazana Mabasa, the chairperson of the Treatment Action Campaign, which has been at the forefront of HIV advocacy in South Africa since 1998. Ms. Mabasa has been actively involved in TAC since 2004 in a wide range of positions, and today represents TAC in the South African National AIDS Council. Ms. Mabasa, please.
Thanks for the opportunity. I will not be doing justice if I don't start by acknowledging the progress that has been done so far in response to HIV and AIDS. However, we are not yet there. We are still facing many challenges in terms of the response when it comes to HIV and AIDS. South Africa is the country that has got the largest program in ARVs, but we have got challenges that at the point now, the ART initiation target has been reached, of which is an achievement, but the survival on treatment is low. We are having challenges when it comes to adherence. We are having patients that are untraceable, of which it indicates that we're still having challenges. It's not only in South Africa, also in other African countries who are encountering those kind of challenges. There is an evidence that HIV treatment reduces transmission. There is a study that has been done in South Africa that proves that 77% in the zero discounted couple, it reduces the infection. However, we still have got challenges when in terms of responding, and also the targets, and also the strategies in terms of the implementation in order to respond to the realities that are happening at the lower level, more especially at the community. I'll speak directly as a community member because I'm from a community, from a rural area where we are still facing challenges in terms of accessing services. There is also an indication that there is a decrease in cases of many opportunistic infections among children living in low and middle income countries when those people are being put, or those children are being put on treatment. Currently, South Africa has approved the test and treat model, of which it is a gear to reach the 1990. However, without the functionality of the health system, that is a challenge. There's no way we can reach or we can achieve the implementation when it comes to the response on HIV and AIDS if we don't have enough community healthcare workers. That is a fact. We travel from the places where we stay in going to try to access services. You find that only few healthcare workers are there to can assist. Some of us, we travel, we go there, we end up not getting assistance, we go back home using transport, and that also is a challenge when it comes to adherence in terms of people who are taking medication. Without dealing with the issue of corruption in the progress will go down. There is no way where we can retain people who are leading in terms of corruption that is going to make the health system functional. In South Africa, there's been a launch in terms of national prevention campaign for girls and young women, and of which it is a hope for if it is implemented, that will mean there will be a control in terms of the infection. We know that there is evidence that indicate that young girls between the age of 15 and 24 are getting infected. We know that globally, 6,000 people are infected daily. We know that currently, yearly, 2 million people are getting infected. That means we are not yet there. We're still having challenges when it comes to prevention. It's not only in South Africa, also in many other countries, African countries, we know those things are happening. We know that there is a study that has proven that PrEP drugs are one of the newest innovations in HIV prevention. They are proven to be effective and affordable. However, if there are no plan for implementation, it's going to be good policies and good strategies, but without implementation, that is going to be zero. We know that in the test and treat model, all individuals should be tested for HIV, and those who test positive will get treatment. And those who are in treatment, when their viral load is undetectable, so therefore it means that we stop the transmission. However, currently when we look, we've got globally about 20 million people that are not accessing treatment, that are lacking access now, of which it means if those people are not receiving that treatment now, it means then the infection is still continuing. So it means that now there is a need for action. There is a need for those people to access treatment, because we know there are many studies that have been conducted that has proven that people, when they are taking treatment and they adhere to the treatment, that can also work as a prevention, because it means that a person who is HIV positive is taking treatment, that person, we are preventing that person not to reach the stage of AIDS. We are also preventing that person not to get opportunistic infections. We are also protecting the next person who, in most cases, I'll refer to the zero discordant couple, where the other person who is negative will be protected for not getting infected. And when it comes to PrEP, we know that according to the efficacy, it shows that people who are HIV negative, or those who will be highly exposed to HIV, then are going to be prevented in the method of PrEP. And those who are in the model of test and treat, it means then when they're taking their treatment and their viral load is undetectable, there is less likely to can transmit the virus to the next person. So these two models, if they're implemented in the African countries, they can really make a change when in terms of high rates that we are currently experiencing in terms of HIV infection. In our view, the test and treat model and the PrEP should be implemented. I just want to make a few calls, more especially to the leaders that are seated in front here, that there is a need to support the United Nations General Secretary on the high-level panel on access to medicine. To facilitate, and also after the facilitation, the report should also be made public. So in terms of supporting, therefore it will mean the countries need to engage when those reports come out, and therefore at the end we support the outcomes to be implemented, because that will mean access to treatment for all the people who need them. And that, therefore, we can talk about the universal access because all the people who need it will get access. Currently, we know that the high prices, the prices that in terms of medication are high, and countries are failing to can afford. So therefore, it means by supporting the United Nations General Secretary on this innovation, that will give a hope to the most of the people that really need currently now, that needs ARVs now. In terms of the intellectual property laws, there is a call to can ensure that the barriers are removed. Because there is no way, if we're not supporting that innovative, that we can face the reality. And also the implementation is not going to happen in countries. And also I want to make a call on the countries that are criminalizing the key population, and more especially the LGBTI. Because if those people who are leaving them behind, there is no way we can address the issue of HIV and AIDS. Then we just have to forget. And that will mean that we are violating the human rights. And also, those countries that are attacking civil society organizations because they speak out, I really want to mention or to appeal for all the honorable that are here at the end, that you really talk senses to these African member states, that there's no way you can work in silos. You really need civil society to can be your hand in glove. We need to work together. There are places where you can't reach, where as civil society we are reaching. We are not the enemy here. We are here to work together. And there's no way you can achieve in responding to the HIV and AIDS if you just want to work alone. And lastly, I want to call on the governments to invest, really investment and in budgeting to ensure that there is money to respond to the issue of HIV and AIDS. In South Africa, we have got many good policies. We have got good strategies. But without budget, then that is going to just be a zero. And I just want to appreciate the Deputy President. There are many things that you are leading in the country that you are really showing commitment. But however, if you don't have the leadership that is supporting you, there's no way you can make it. And I also just want to appreciate the minister, our minister, Aaron Motsoaledi. There's a good work that you are doing, but really we need to work together here. As civil society, as also want to make a call to the donors, pulling out for making sure that there is fund. It means then you are taking the hope from us, from the poor people on the ground. As a person, I know where I'm coming. There are still a lot of challenges that are happening there. And you cannot understand if you have never left your office or left your comfort zone and go and find out what exactly is happening. I know what it means to see a person dying in front of you without help, without an ambulance coming to pick, without the healthcare workers that is trying to assist other people, and because you are many, no one is coming to can assist you. So by this I'm saying community healthcare workers is a key to making sure that we reach the 1990. I thank you.
Finally, we're delighted to be joined by Charlize Theron. Many of you will recognize Ms. Theron as an Academy Award-winning actor, but she is a UN messenger of peace and the deeply engaged founder of the Charlize Theron Africa Outreach Project, which invests in African youth, primarily in South Africa, to keep them safe from HIV/AIDS. Since its founding in 2007, Africa Outreach Project has reached over 200,000 young people advocating for effective international and national policies. Ms. Theron.
Thank you so much. This is quite an esteemed panel to be on. Some of you I've worked closely with. I appreciate the time that you've always given me to be able to talk about the one part of this fight that I'm very passionate about, and that is the teenagers, the stubborn teenagers, the adolescents, the ones that we haven't paid enough attention to. I'm very grateful to be a part of this conference this year because I hope to be a voice for those young girls, young boys who we have not paid attention to at all and have finally given us enough reason to stop and to say we might have made a mistake. I'm also very excited to be here as a South African, I think it's pretty hard to find a South African who has not personally been affected by AIDS or HIV, or whether it's a personal loss, just the devastating effects that this virus has had on our country. And I think being part of this fight against AIDS has been a very personal passion of mine for a very long time. I started CTOP in 2007 to invest in the young youth, to invest in the whole person, so that they will keep themselves safe from HIV. I wanted to do this through community-based organizations because I think that is the only way we will ever reach those most vulnerable. I think the communities are the ones who are in the trenches. They are living this life with those people. And I don't think we give them enough credit or enough support. And I think until we actually effectively reach these young people and get them effectively engaged, to empower them, to want better for themselves, to have the tools, the resources to do that, nothing is going to change in the fight of this epidemic. We will be maintaining AIDS. And like Michelle Sidibe said, we might be pushing this rock up this entire hill again. We are so close to pushing it over the edge. There needs to be more conversation about ending this epidemic and not just sustaining it or maintaining it. And there is a real reality to that. I believe that reality is with the youth. I think they will be the generation, if we bring them into the room and if we let them truly be part of this conversation, who will be the generation to end AIDS. I don't think there's enough conversation about that. I understand that there is an everyday need to address, but I think we are so close. I do believe that we can, as the UN has stated, stop and end AIDS by 2013. If we really ask ourselves why we haven't stopped this epidemic yet, I think that's the question we all need to ask ourselves at this conference. Because I think there's a frightening answer behind that. I think we give a lot of reasons for why it hasn't happened. But I think ultimately when we look into our own humanity and why that hasn't happened, there's some real harsh realities when it comes to why this epidemic is still unnecessarily taking so many lives. HIV and AIDS is the #1 killer of adolescents in Africa, sub-Saharan Africa. It is the #2 killer of adolescents globally. Why are we not caring about that? This is not something that just affects Africans. This is a nationwide, worldwide, global-wide issue. Our young people are dying at a rate that should frighten us. And yet somehow we just don't talk about them at all. They are the forgotten ones. I see all the great strides that we've achieved, that I've been so lucky to have been a small part of. I have seen countries step and accept their certificates for having zero transmission from mother to child very recently. Very impressive, very exciting. We have made a tremendous stride in those areas, but I think we have to acknowledge that we have really neglected our adolescents, especially young girls. The prevalency is too high to not think about them in a much more effective manner. And so that's why I'm here today. I'm here because I believe we can stop this. AIDS is 100% preventable, so it's time to have that conversation for real. Thank you for letting me be here.
Thank you so much, Ms. Theron. We now have just a few minutes for the Q&A. I'd like to ask you, if you would like to ask a question, to please state your name, your media outlet, and if there's a specific person on the panel that you're asking your question to please name that. We have a mobile microphone. Just while we're getting going with the questions, I'd also like to invite Steve Letsike, who is the civil society leader for the South African National AIDS Council, to join us. She also will be available to answer your questions. So, Rob, where are you? Who's got the first mic? Please.
Hi. Hello?
Steve, if you would join me here. Please.
Hi, Jeff Berry from Positively Aware magazine. Thank you, panelists, for a very enlightening conversation. My question is, maybe for Ms. Mavasa and Ms. Theron. In light of some false hopes about a cure, and we're talking about cure here at the conference, and also, the recent partner study, which showed that it's highly unlikely and, it's effectively zero chance of transmission if you're on treatment. How do you communicate that within the community, those challenges around cure, research, and zero transmission?
I think everybody knows that, funding for vaccines or a cure and keeping people on treatment has definitely been in the forefront. And, how we kind of discuss the truths and not having all these kind of taboos and misgivings of what it really means to be on the medications and what that really means and what is the, like she spoke so, she articulated so well that there is, I think, above a 70% chance of not transmitting if you are on the drugs. All of these things are something that is our responsibility to communicate on a very truthful level. I think to keep our hopes up on things like that is not necessarily where we should place all our entirety of our energy and of our funding. I think that there's a great hope of people really working very well towards all of those things, but at the same time, we are neglecting the idea of speaking in a language that's not just about hopes and dreams of some cure coming around and fixing us. If we stay in that space of thinking, people will die. And so I think we have to learn to have a conversation about this that is not just focused on one aspect of it. I feel like there's so many aspects of it that all bleed into each other. They're all interconnected with each other. And the conversation has to be broader than just, can we find a cure? Can we find the miracle? I think the realities of this virus is very, very real, and we have to be able to look at it that way and not necessarily give people false hope.
Thank you. There was another question over here. Do you have the microphone? Oh, go ahead.
Joe Stolley from African News Agency. This is for Deputy President Cyril Ramaphosa. I've just been to a presentation earlier on this morning, and it was highlighted by one of the speakers, Glenda Gray from the Medical Research Council, that in fact one of the big problems is financing for research and development. While she praised your government in terms of the ARV program and what you've done, she said that basically the moment recession comes, and she applied this to the whole of Africa, that effectively in Africa there are not enough scientists for a disease that is hitting Africa. And how do you, and that R&D is viewed as a luxury. What are you guys going to do about that?
Well, the issue of R&D has been prominently raised not only by scientists but also within government circles. Minister of Science and Technology, and indeed our Minister of Health have been in the forefront of raising this issue and have been urging not only government but also a number of institutions, particularly business, to increase their spending on R&D, because R&D in the end is really the one hope that we've all got to move the needle when it comes to new inventions, new innovations, new processes and new ways of doing things. And countries that have been successful in a number of things, be it either commercially or even in terms of health, have been countries that have invested quite heavily in R&D. We've accepted as a country that we've been lagging behind, and we're now going to have a step change to focus more on R&D. And of course, the economic situations that we face as a country have taken resources that could easily have been spent in R&D into other priorities. But we are evaluating that and re-evaluating that, for we know that through R&D we will be able not only in a number of areas, but also when it comes to HIV, to spend money to finance research, scientists, health workers, to have the wherewithal to be able to push, the barriers and begin to get into areas that could find better and more functional solutions. This is our commitment as South Africa. Our level of consciousness and awareness on this issue has been raised quite exponentially. So we are going to see step change in this regard as well. But we'd also like to thank the international community who have been able to fund research that we are benefiting quite a great deal on. And of course, research continues even in our own country, our universities, and a number of other places. So we are grateful, but we accept that we've got to do more. Thank you.
Thank you, and I would just like to say a point of information for the conference that this is the largest number of scientific abstracts we've ever received from African scientists, and about 32% or so of the speakers are African. This is also the first conference where the majority of speakers are women in the scientific program, and that really reflects where the field is going. Last question.
Hi there. My name is Jordan Taylor. I'm a reporter at the U.S. news site Mike. My question's for Charlize Theron. You mentioned that there's a frightening answer, a harsh reality about why we're not talking about all of these young women and young men who are dying. And I was wondering if you could explain what you think, at least, that frightening answer is.
God, I just can't seem to get that part down. I'm kind of... I really want to speak about that tonight. I've spent a lot of time thinking about how I want to address that tonight at the opening ceremonies. And so I don't know if I want to go into the detail. I feel like it's like giving the plot of a movie away. I don't really want, I would encourage you, don't do it. Should I not do it? I think asking the question is what I feel comfortable right now doing here, and I will be not answering, but stating very much what I think the answer is to that question. And I hope people are willing to hear that tonight. I'm sorry, that sounds like I'm trying to tease you or something. I'm not trying to do that. I'm just trying to kind of follow protocol with what's happening tonight and here today. All right, okay.
So stay tuned is the answer there. I'm afraid that's all we have time for today. We've run over. I want to ask you to thank again all of our terrific speakers, and to all of you for joining us at the AIDS conference. We look forward to seeing you in the opening ceremony this evening and back here in the Media Center throughout the week. Sorry about that, my dear.
Yeah, it's the same drop off. It's the same drop off.